Hello and welcome. You're watching NDTV. I'm Sarah Jacob. We are now in lockdown 4.0, which means that some things are going to change for us. In the capital, for example, all markets are now going to be open on an odd and even basis, where we're also told that there'll be only 20 people in buses while buses will run. Public transport has been opened up. Only 2 passengers in taxis. All offices are to be opened in the capital. In Kerala, for example, shopping complexes have been opened up, but with some riders. In West Bengal, private offices can open with 50% strength on alternate days. Kerala says that shopping complexes will be allowed to be open with 50%. And remember, both Kerala and Bengal are saying that salons, beauty parlors can open, but they have to follow social distancing. Remember, while the economy and the restrictions are being eased up, the numbers of coronavirus cases continue to rise. In fact, we're expected to peak only sometime next month. So, keeping this in mind, what is it that you need to do to keep yourselves and your loved ones safe and free from catching the coronavirus? That's why we have this show. It's our Doctors on Call show. We bring you the best in the business to answer all of your questions, your fears, your concerns. Tonight we have on the show, we have Dr. Anant Nigam. He's the director of the Nigam Diabetes Center in Jaipur, senior diabetes specialist. We also have Dr. Parag Shah. He's an endocrinologist of the Jeevraj Mehta Hospital in Ahmedabad, and Dr. Debjyoti Sarkar, an intervention cardiologist at the Ananda Lok Hospital in Siliguri. So let me start first by asking you, Dr. Nigam, you just heard me spell out the changes. I think one thing that everybody has been looking forward to has been the ability to get a haircut. Everybody's starting to look rather disheveled, this new coronavirus look. The men with their man beards and you know their man buns and their new beards. What would you advise to someone who is now finally heaving a sigh of relief that they can go into a parlor and get their hair cut if they wanted to? What would you advise them? 1, should they do that? And 2, if they are to do that, what are the precautions do they need to take?
I think the most important thing that one needs to realize is that whatever you're doing is not only for yourself, for the other person. So the salon guy also needs to understand that he's got to maintain physical distancing. He's got to sanitize his equipment. He's got to sanitize his hands and wear gloves to do that, which is rather rare, and also keep that distance, whatever he can. I know sometimes he's got to get close to the person. Similarly, the person who's going in has to wear mask, so has the barber to wear mask. So important is social distancing, physical distancing, washing hands, sanitizing yourself. I know people are just curious to find out what's happening and going out and seeing if shops are open. And so people want to go to the salon. Well, do that, but with great care. That's very important because the contact there is really close and you can't do that from 6 feet away. So that's going to be really challenging for everybody.
So let me also quickly add to that. What about shaving for men? Because you're using the same razor blade, things like that. You have to get quite close. Would you advise our viewers to go ahead for that?
Yeah, Sarah, I think that's a very important point, and I would advise everybody to shave at home or don't shave. Using the same blade and you don't know how the person has sanitized. So it's extremely important not to let anybody come close to your mouth. That's very important because mouth, nose, and ears have to be really protected. Wear simple plain glasses just to avoid putting your eye there. So in case a hair falls into your eye and you just try and rub it. So all these things have to be kept in mind. So
best you're saying if you can avoid it, and if not, make sure you take all those precautions. All right. I want to also ask what one should do when you go into offices, but I have Saqib Hussain joining us from Siliguri. Go ahead, Mr. Hussain, with your question.
Yes, ma'am. I am Saqib Hussain from West Bengal. My question is that, ma'am, no one from my family has been exposed to the coronavirus until now, and no one is sick and unhealthy till now. Can we get together for a family dinner or lunch? There are 7 of us, ages 2 to 64.
From age 2 to 64. Dr. Shah, would you like to answer that question? I think Saqib Hussain has, voiced something that many people all over the country are struggling with. They've all been within their homes for the past 50 days. And now as the lockdown is easing, they're wondering if they can meet parents, meet grandparents. So this family, Mr. Hussein's family, has someone as young as 2 years old and someone as old as 60, but they want to meet. What would you advise them, Dr. Shah?
I think we have to be very careful. Those who are less than 10 years of age and those who are more than 60 years of age, try to avoid to the place where the likelihood of having a close distance is very low. So try to avoid places. If you want to go for a dinner, suppose, try to go with age group between 10 to 55 or 60 at the most. Try to keep a distance. Hand hygiene is very, very crucial. We all know about the mask, but mask hygiene also is very, very crucial. Don't touch your mask with your hands from the front, just touch the sling. Second is the hand hygiene. Don't touch the surfaces. Even if you touch the surface, it's better to sanitize each time you touch the surface. Like the cutleries. Cutleries are all of metal. And we all know metal, it can last
So,
up
Dr.
to 3
Sarkar,
days.
what Saqib Hussain was saying is that each of his family members have been under strict quarantine, strict lockdown, and nobody has shown any symptoms over the past 50 days. That's why he's asking, can they meet another close family member who has also been under strict lockdown for 50 days?
Yeah, if you are having a family dinner at your home, then it's fine. If you're going out for a dinner, then you have to be very, very cautious and take the due precautions.
Okay, so I think they're talking about family dinner. So, Mr. Hussain,
Yeah, family dinner is fine. But
but with precautions. It's
Somebody is
always
going
important to keep those precautions in mind. Children under 2,
Yeah, because
people
you
over
can
60
be a
need to be
asymptomatic
looked
carrier.
after. Okay,
Yeah.
Anup from Kolkata has a question.
Yeah. Hello.
Anup, go ahead.
Yeah. Good evening, everybody. Yeah. My question is, since offices and factories have started, I have some customers and suppliers will be coming. Suppose if I shake hand with, by mistake, I shake hand with somebody and it turns out to be positive. And if I wash the hand and don't touch the mouth any point of time, and I sanitize my hand later, but I have been contact with her and he turns out to be positive later. So will I contact the virus?
Mr. Anup, I don't have to be a doctor to tell you no handshaking. The elbow bump is the way to go nowadays. But Dr. Anant Nigam, go ahead. What's your response?
I think the world is following India and say your namaste. I think that's the way to go. And coming scientifically, if you washed your hands immediately and sanitized them well, the 20-second wash, both the front and the back of the hand, I think then you don't get the virus like this. It's only go when you touch and get to think to your mouth or your nose or the eye. But just do this.
There is a term called close contact. This close contact means within 2 meters and 15 minutes duration. Just a mere handshake, and if the person does not touch his face with his hand, then there is very less chance of getting the coronavirus infection, even if the patient is turned out to be a COVID positive later. So what we need to do, even if someone shakes his hand, he has to sanitize his hands very at the very beginning.
I would just like to add, it's important that both parties are wearing masks. That's extremely important because now data tells us that even breathing and talking can just throw out those small droplets, and they can be dangerous. So you have to wear masks.
And keep 6 feet
That is
distance.
extremely important.
Yes.
Extremely
Please
important.
don't
Keep the 6 feet distance.
and please don't entertain anyone without mask. That should be the norm. Whenever, because I am a doctor, whenever I am seeing any patients, I don't entertain any patients who is not wearing any mask.
Yeah.
The same thing should be done if someone comes to office also. The person should always wear a mask, be it a cloth mask, be it surgical mask, anything.
A good point. Even in the markets that I've been to get essential groceries, there are stores that don't allow you in unless you're wearing a mask. You're just not allowed in. But Anup,
one important thing I want to emphasize is that it gives a false sense of security if someone wears gloves. Rather, it increases the chances of cross infection. So rather, it is better not to wear gloves. Rather, if you touch anything, then wash your hands after touching it, or sanitize it after rubbing with a 70% alcohol containing any hand rub.
Okay.
That should be better.
Okay. So I think, Anup, a lot of the questions today will have to do with how one should protect themselves, because now offices are opening up across the country. Sundar from Nashik has a question. Sundar, what's your question? Do we have Sundar?
Can I go ahead and ask the question, madam?
Yes, please. Go ahead.
Yeah, my question is actually the lockdown. We are in the 4th phase of lockdown. So it is as good as we are out of the lockdown almost. So is the medical fraternity across the nation, are they equipped in case of any spurt in the number of cases? Because the chances of spurt looks large. So is the medical fraternity across the India, are they equipped to handle in case of any, God forbid it shouldn't happen, in case if it happens, are we equipped enough? That's what my worry is, and my question is also, madam, please.
Dr. Parag Shah?
Yeah, I think whatever is the detected positive, there is likelihood of large number of asymptomatic carriers. So for next 3 to 6 months, we have to consider everyone as a corona positive to protect ourselves and to protect the other people. Hand hygiene, face hygiene, and don't touch the MEN, what we say, mouth, ear, and don't touch that. Have the proper mask, have the social distancing, and sanitize yourself. So we don't see a large surge of the cases, which we are expecting actually post lockdown, because most of the people would follow, but there will be some number of the people who would not follow. And I have one observation that people do wear masks, but while they are talking, they put the mask down. They clear the mask off their nose to breathe it easily when they are talking. So please don't put your mask below your nose till you are talking to somebody, and it should be present right from the step you step out from your home till you are back to your home. It should be continuously wear, though it may be difficult initially. Those who are locked down and did not go out for a long period of time, now offices are open. You may have to work for 6 hours or so. Keep the mask on, keep the sanitizer ready. As soon as you touch any substance, any surface, you just sanitize for at least 30 seconds. You sanitize the tips of the fingers. That is what I observed. People don't sanitize the tips of the fingers. It is slightly difficult to sanitize the tip of the fingers. So sanitize the tip of the fingers to decrease the surge which we are expecting once the lockdown is eased out.
No, what do you mean? We put a sanitizer and you rub your hands. That's what you've normally heard. You're saying just do the tips of your fingers?
Yeah, you rub the sanitizer with your fingertips also. You have something in some sanitizer on your palm.
So you're saying over and above what you do on your palm, make sure you get your fingertips.
Okay. Like this also. And keep your nails cut. Many people have uncut nails.
The nails should be cut, because in the nail group, lots of viruses may be there.
Exactly,
so
nails should be cut.
Nails should be cut.
Okay, that's a good point. Everybody should keep their nails short, because that's a space where viruses can gather and thrive. Let's quickly take a short break. We'll come back. We have Balaji, I know, waiting. We'll come back to this caller from Bangalore. Just a short break. Welcome back. We have our doctors here. Let's quickly try and take 2 callers. Balaji from Bangalore and Shantanu joining us. Go ahead, Balaji, with your question.
So my question is about dental practitioners. How do we know if the doctor is not an asymptomatic carrier, and whether it's safe to actually go in for a dentist appointment, because it's almost 2 months and one has to take care of dental health as well?
All right. And Shantanu, can we hear your question too in the interest of time? Okay, we don't have Shantanu. So, Dr. Shah, Dr. Sarkar, why don't you take that question about going to a dentist? This is an emergency clearly for Balaji. He needs to see his dentist, but he's worried because how would you know if anyone is asymptomatic?
So, if someone is asymptomatic, you don't know. It is very difficult to know whether that person or that doctor or dentist is a COVID carrier or not. But if you can ask the doctor if anyone in his locality or anyone in his close contact has suffered from a COVID-related problem or something like that. If it may indirectly indicate that he might have.
But I think Mr. Balaji's fears are the fact that the dentist would have to lean close to your face, Dr. Sarkar. You know, the dentist would obviously be leaning close to your face and your mouth. That's probably what's worrying the caller, Mr. Balaji. So, would you advise him to still go ahead?
In which zone he is. If he is in red zone, that means the community is very much. Here, the doctor should get RT-PCR done to him to rule out any presence of COVID. I think that might come in future weeks.
Okay.
That guideline has not yet come, but sooner as we are more going out, this procedure may come or this indication
Let me
may come.
quickly try and squeeze in one last caller, Shantanu.
My question is, there are two questions. Hello, can you hear me?
Yeah, go ahead.
First is, how effective mask is in preventing the infection, the corona infection? And two, many people are talking about herd immunity, that the virus is going to stay and we have to live with it. How effective is herd immunity and how can one acquire herd immunity and how long will it take?
Okay, Dr. Nigam, last word to you on the show. We're out of time.
Yeah. Well, herd immunity probably is being misused. The WHO has really warned us, herd immunity is when 60 or 70% people have been vaccinated. And then you think the other population will get immune. But to use it in context of a pandemic like this is rather dangerous. Sweden, United Kingdom, everybody tried it. And look at Sweden now. Their fatality rates of almost as high as 12%. So we'll have to just watch the virus. We'll have to go very slowly. And herd immunity is probably not a great idea. You'll infect large number of people and your arithmetic there would be brutal.
Right.
You'll have large population getting sick and your hospitals will get flooded.
All right. Thank you so much. All our doctors were completely out of time. But for all our viewers who still have questions, we have the show every day of the week. Join us then and we'll bring you more experts every day. New show with new experts. Bye-bye. Thank you.